Hello everyone, I am Teresa Ginunyaza Peligro, a first nursing student in Butuan Doctors College, and this video is a turning and positioning a client in bed return demonstration. Turning and positioning a client on bed. It is the technique in repositioning client in bed. The purpose, it aims to prevent complications that may arise while client is confined in bed. Positions client for comfort and body alignment, and positions client for a variety of clinical procedures. The equipment needed are pillows, rolled blanket or towels, footboard, and hospital bed. For assessment, number 1, assess client's physical abilities, level of comfort, and ability to follow instructions. Number 2, check client's chart for diagnosis. It is to identify if the patient is able to participate and to determine any contradictions or contractions and avoid it. For planning, wash hands to avoid any contaminations of microorganisms. Number 4, organize and check the device for its function, like the bed, the lifter, and the trapeze. It is to avoid any contamination and spread of microorganisms for hand washing, and to secure that the patient is safe and do the procedure perfectly and safely. For implementation, number 5, identify the client. Explain the procedure to the client. To care the right client and to avoid any confusion to patient, it is a must to let them know what the nurse is going to do. Number 6, raise bed to safe working height and ensure that brakes are applied. It is to ensure that the patient is safe and avoid any possible injuries while doing the procedure. Number 7, secure all tubes, drains, and IVs to make the patient comfortable during the procedure. Number 8, place or assist client in a starting position to let the patient know that the procedure is starting and a need to assist. The first position that we are going to do is letter A, dorsal or supine position, lying horizontally on the back. It is to remain in natural neutral alignment and to maintain adequate respiratory function with no constricting and external compression the respiratory system. Letter B, dorsal recumbent. It is a supine position with patient lying on back, head and shoulder with extremities moderately flexed. Legs may be extended. It is to allow for examination of the head, neck, anterior thorax, lungs, breast, axillae, and the heart. Letter C, the lithotomy position, lying supine with hips and knees flexed and thighs abducted and rotated externally. It is used for gynecology, colorectal, urology, perineal or pelvis procedures. It was the start birthing positions and also to limit nerve injuries. Next is the Fowler's position. That has 4 types. It is a posture assumed by the patient when head of the bed is raised approximately 15 to 90 degrees. It has the 4 types, which is the first, low Fowler's position is when the head of bed is elevated by 15 to 30 degrees. Then the semi-Fowler's position is 40 to 45 degrees, and the standard fallers is 45 to 60 degrees, and the high fallers position is 80 to 90 degrees. It is to allow for a better chest expansion, improving breathing by facilitating oxygenation, and to provide patient comfort and care. Next is the orthopneic position. It is the posture assumed by the patient sitting up in bed at 90 degrees angle, sometimes resting toward supported by pillow on over bed table. This position is used for patients with breathing difficulties. It allows maximum expansion of the chest, and it helps in exhaling. Next is the Sims position, lateral or side lying. It is a position in which patient lies on left side with knee and thigh drawn upward toward chest. It is used in unconscious clients because it facilitates drainage from the mouth and prevents aspiration of fluids. It also reduces lower body pressure and reduces pressure over the sacrum and greater trochanter of the hip. Next is the prone position. Being in horizontal position when lying, face down. It is to improve oxygenation and blood return to the chambers on the right side of the heart, increases and contractions of the blood vessels of the lung decreases. Next is from prone position to supine position. To proceed to the next procedure, from prone position to the client should be in a supine position. Next is knee chest or genopectoral position. Patient kneels so that the weight of body is supported by knees and chest, with abdomen raised, head turned to one side, and arms are flexed. To promote significant changes in venous return and cardiac output, it is often used in supine surgery. Next is the Trendelenburg position. It is a position in which head is low and body and legs are on inclined plane. It is used in situations such as hypertension and medical emergencies. It helps promote venous return to major organs such as heart and head. Evaluation, number 9, evaluate client's tolerance and response to the procedure. Always check the vital signs before and after the procedure. Number 10, evaluate the client's position for alignment. Number 11, evaluate any abnormal findings of skin assessment. It is to ensure that the patient is doing good and determine if any physical or mental problem occur before and after the procedure. And last is for the documentation. Number 12, record the client's position. Number 13, record any complaints of pain, dyspnea, and discomfort observed during repositioning. Number 14, record the client's response after the procedure. It is to identify if any physical problem or other pain is felt and ensure that the patient get the right care at the right time and to provide clear and precise account of the client's health care. Okay, so we're now done with the positioning and now let's proceed to the transferring technique. So transferring technique, it is the use of proper body mechanics in repositioning, lifting and transferring of patients safely. The purpose of this, position and prepares the client for a variety of clinical procedures. The movement maintains and restores muscle tone. The equipment needed are bed, wheelchair or chair, stretcher, pillows, and safety belt. In assisting client from bed to wheelchair or chair, first, we have to do the assessment. Number 1, check the doctor's order and client's diagnosis and restriction. Checking the patient's chart to provide care at the right patient and the right time. Number 2, assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instructions. Change of position may cause dizziness to the patient due to drop in blood pressure. Then, we proceed to the cleaning. Number 3, wash hands. It prevents cross-contamination and spread of pathogens or microorganisms. Number 4, obtain equipment needed and check its function for convenience and secure when doing the assessment. For implementation, number 5, identify the client. Inform client about desired purpose and destination. It allows the client to cooperate accordingly. Number 6, lower the height of the bed and slowly raise the head of the bed if not contraindicated, for easy and avoid inconvenience when starting the positioning. Then number 7, place one arm under the client's legs and one arm under the client's back. Slowly pivot the client and put client in sitting position. It allows the client to dangle for 2 to 5 minutes It allows the client to adjust the position change. Number 9, bring the chair or the wheelchair close to the side of the bed. Place it at 45 degrees angle of the bed. Bring the wheelchair beside the bed for convenience purposes. Number 10, lock wheelchair brakes and elevate the foot pedal. When the wheel is locked, it prevents the chair from moving. Number 11, put transfer belt and other transfer aid is needed and secure. Gate belts reduce strain on your back and provides for security for the client. Number 12, lifters knees flexed with back straight, hand gripping each side of transfer belt as it improves your base of support. The number 13, rock each client up in a standing position to the count of 3 while straightening hips and legs and keeping knees slightly flexed. It allows you and the client to work together and it minimizes strain on your back. Number 14, lifter and client pivot so the lifter and the client's back is toward chair, lifter still holding the transfer belt. Instruct client to use armrest on chair, flex hips and knees while lowering into chair or the wheelchair. Shoulder and hips should be straight line to reduce stress on spine and joints. The number 16, secure the safety belt. Place client's foot on pedal. It prevents client from falling from the chair, of course. The number 17, again, wash hands because it avoids contamination and transfer of pathogen from the other clients. The count of 3. 1, 2, 3. For evaluation, number 9, evaluate client's tolerance and response to the procedure. Always check the vital signs before and after the procedure. Number 10, evaluate the client's position for alignment. Number 11, evaluate any abnormal findings of skin assessment. It is to ensure that the patient is doing good and determine if any physical or mental problem occur before and after the procedure. And last is for the documentation. Number 12, record the client's position. Number 13, record any complaints of pain, dyspnea, and discomfort observed during repositioning. Number 14, record the client's response after the procedure. It is to identify if any physical problem or other pain is felt and ensure that the patient get the right care at the right time, and to provide clear and precise account of the client's health care. Okay, we're now done with assisting client from bed to wheelchair. So now let's proceed to in assisting client from bed to the stretcher. Assessment. Number 1, assess amount of assistance required for transfer. Assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instructions. In planning, number 1, wash hands. It prevents cross-contaminations and the spread of pathogens or the microorganisms. Then number 4, obtain equipment needed and check its function. Number 4 is for convenience and secure windowing the assessment. For the implementation, number 5, identify the client, inform client about the desired purpose and destination. It allows the client to cooperate accordingly. Number 6, position stretcher from head near foot of the bed. As a result, the patient may be readily transferred to the stretcher. Number 7, raise bed to 1 inch higher than the stretcher and block breaks of bed. It is to avoid back strain. Raise the bed to a comfortable working height and secure the patient in the stretcher to prevent them from falling. Number 8, 3 lifters. We have 2 lifters stand side by side facing side of the client's bed. The tallest places are arm under patient's back and shoulders. Second nurse places one arm under waist and thighs. Third and shortest lifter places arms, legs under legs. This keeps the patient's heaviest section near to the healthcare professional center of gravity. Number 9, lifters roll client toward their chest on count of 3. Client is lifted and held against nurse's chest. It is to provide a strong force in lifting the patient up. Number 10, on count of 3, lifters step back and pivot towards stretcher. Having a support force minimizes the risk of harm. Number 11, lifter gently lower client in the center of the stretcher by flexing knees and hips until elbows are in level with edge of stretcher. It is to lower the risk of harm. Furthermore, proper body mechanics should be used whenever you move a patient or lift, push or pull an object. If improper body mechanics are employed, even a modest weight might induce lower back discomfort. Number 12, position client on stretcher, then place pillows under head and cover client with blanket. Maintain the patient's airway and circulation throughout the procedure. Number 13, assess client's body alignment. Place safety straps across body and raise side rails. Correct alignment helps to maintain bodily equilibrium and reduces pressure on musculoskeletal structures. Number 14, wash hands after you do the procedure. It avoid contamination and transfer of pathogen from the other client. For evaluation, number 9, evaluate client's tolerance and response to the procedure. Always check the vital signs before and after the procedure. Number 10, evaluate the client's position for alignment. Number 11, evaluate any abnormal findings of skin assessment. It is to ensure that the patient is doing good and determine if any physical or mental problem occur before and after the procedure. And last is for the documentation. Number 12, record the client's position. Number 13, record any complaints of pain, dyspnea, and discomfort observed during repositioning. Number 14, record the client's response after the procedure. It is to identify if any physical problem or other pain is felt and ensure that the patient gets the right care at the right time, and to provide clear and precise account of the client's health